a little bit fits into what we may talk about tomorrow. She's a 51-year-old lady. So, we started her on a nutritional regimen, but she presented to us, 51-year-old lady with hypertension, hypothyroidism, hyperlipidemia, and GERD. And she was having chest discomfort and some exertional fatigue. Now, sometimes you may think the chest discomfort is the GERD. Sometimes, when people have, reflux, they don't know if it's cardiac or reflux. And I remember having one patient whose cardiac angina was just sort of a throat sensation, and her GERD was substernal chest height. And so, because you could have features in two different areas that can be confusing unless, you know your body. In this case, she did, and we were able to figure out what was going on with her. This is years ago. But anyway, this patient was taking medications and amlodipine, metoprolol, aspirin, hydrochlorothiazide, simvastatin, and a natural thyroid supplement. So she was on the typical, medication you prescribe somebody her age with her condition. However, she continued to have symptoms now. In May of 2019, she was seeing a cardiologist in Louisiana. He did a coronary angiogram and saw that she had a 70% stenosis in the left anterior descending. So you got the branches here, the left main, and it branches into the circumflex on the left and the anterior descending on the left. And her stenosis is right here in the proximal area. They call that the widowmaker.
Define stenosis for us.
A narrowing. Some people refer to it as blockage, but it's not truly a blockage, but it's a narrowing. And so there's a narrowing where there's obstruction of flow right here. And it was 70% obstructed or 70% narrow. And so that decreased flow. And so that was likely the contributing factor of her chest discomfort. And this is a very important artery because it supplies blood flow to about 75% of the left ventricle, according to some estimates. You have a rupture here and it closes down, you can have sudden death. And so they refer to that as the widowmaker. The widowmaker is referred to as traditionally coronary disease thought to be a man's disease. And so you think of this as something killing a man, but more women die from heart disease than men nowadays. That may have been the case even then. So our previous cardiologist adjusted her medications and discussed continued medication management versus stent placement. She wanted to know if she could use an integrative approach to improve her heart disease. She had some fear regarding surgical intervention and thought there must have been another approach. And so she saw, information about us online. And so she came to see us. So she didn't want to undergo stent placement or bypass or anything like that. So we performed additional testing. We did an echocardiogram or stress test. The pumping function of her heart was normal. That's the ejection fraction. Ejection fraction percentage of blood that the heart ejects or squeezes out every contraction. So a little bit more than half is normal. And she was able to walk 4 minutes and 30 seconds on a Bruce protocol treadmill, but she had to stop due to fatigue. So this was likely her anginal syndrome, fatigue, that stopped her from walking in 4 minutes. So she started our standard detox regimen, a 28-day plant-based detox regimen. And the data that we have published on that, this detox that reduces inflammation, which is very good for people with coronary disease. Because oftentimes you have a stenosis or narrowing. A lot of it's due to swelling and inflammation in the vessel wall that's causing that narrowing to get worse. And it can predispose, rupture that plaque, and therefore causing a heart attack. So when you go on a detox diet, you start to put the fire out from day one. And so within the first week, you have lots of inflammation that's been reduced. In 4 weeks, it's a 30% reduction based on our data. And some people more than that. So the nutritional detox, we were able to begin to wean some of her medications to the point of discontinuation. We replaced the beta blocker metoprolol with diastolic, and we saw an improvement over time. In 20 days, she lost about 24 pounds, and the blood pressure improved significantly. And so she was on 4 fewer medications at the time. So medication reduction is very important because oftentimes medication, particularly statins, they can contribute to impairing somebody's ability to exercise. Beta blockers can do the same, but hydrochlorothiazide dehydrates you. So that can contribute to fatigue, and it also can contribute to decreased cardiac output, which may worsen your symptoms. So the medications can be working against you. But we also measured an inflammatory score called the pulse score, and she had over 5% increased risk of cardiac event in 5 years when we saw her. That went down to about 2.5%. So that was cut in half. And so that all happened within 28 days. It was pretty impressive. So over the next year, she remained on the plant-based diet. And actually, most recently, she and her husband, who comes and sees us regularly, we put them on a raw diet, primarily with time-restricted eating. And so she lost even more weight, feeling even better. We most recently stopped her last medication, not taking any medications for blood pressure. And she, as stated here on the slide, consumes food within a 6-hour window. She and her husband does fine. Weight decreased from 270 to 240 in that period of time. A repeated stress tests showed her exercise time went from 4.5 minutes to about 9 minutes, 14 seconds. So it over doubled, more than doubled. Again, better functional status, but a lot of it's not only the detox, but the fact we were able to wean the medications and her cardiac performance got better. Here's that pulse score, that inflammatory marker score. It went from 5.24 down to 2. So that's, within the normal range for her. And weight loss to 66 pounds at that point in time. So the repeat angiogram was done to assess the 70% blockage. And on the repeat angiogram, we did the CT angiogram, and that showed that the LED plaque was less than 20%. So it went from 70% to less than 20%. And that's about 1.5 years. It may have gone, that may have decreased that much sooner than this. This is just as soon as we measured it. Repeat echo showed her ejection fraction was about 60%. So there's some improvement there. So looking at our labs over time, we look at different things, fractionated particle size, because it's not just the cholesterol, it's just the particles that they travel in. And the small particles are more atherogenic. Over time, that came down from about near 200, over 200 down to 159. The Lp(a) came down to 81. Still have some ways to go, but it's moving in the right direction. As we said, weight loss was 89 pounds over time, so that was pretty tremendous. She's weighing 205 pounds now, and her weight continues to go down. She and her husband continue to follow the plan. We'll get them into a workout program as well, and we'll also get her into infrared sauna on a regular basis. But again, another example, these case presentations are designed to just sort of give you a close-up of what happens when you can do simple things, but in a more definitive way. And it works pretty effectively. Everybody has different results from the standpoint of how long it takes, but by and large, this is a consistent pattern that we see, that we have seen in our practice for well over 2 decades.
So I have one question from Dana. She says, I have a 50% blockage in my widowmaker. I have no symptoms. I can exercise without any pain. The plaque has not progressed in the last 5 years as seen in a CT coronary angiogram. Question 1, can your body build collaterals to pump blood to the heart?
Yes.
Okay. Question 2, if the plaque has been there for 5 years, is it calcified with less chance of breaking off?
Very likely. It's probably a stable plaque. And that's why we look at inflammatory markers and blood tests to determine the amount of inflammation that's in your system. Tests like the pulse score will get some insight into whether or not you have some inflammatory processes in your vasculature and therefore possibly unstable plaque. But if you're following, natural plant-based diet and you're doing, exercise and all of these things, then those are things that are going to be anti-inflammatory and therefore have favorable impact on your cardiovascular system.
Question 3, she wants to know, am I a walking, running time bomb, or does it progress slowly? At what percentage of blockage do you start feeling something?
That's a good question. Typically people can have symptoms without any significant narrowing in the epicardial coronary arteries because a lot of it can be in the small vessels. So we've done, the majority of people who have symptoms or have abnormal perfusion studies on nuclear stress tests, get a cath, they don't have, significant plaque that's seen on angiogram. So you can have angiogram that doesn't show any significant quote unquote narrowing or blockages, but still have symptoms. And that's likely due to the microvasculature that is dysfunctional at the very least. And they have the disease also. There's a lot of vessels that we don't see that could be causing symptoms. So even though we may say, well, it has to be, X% narrowing, that's not true. You have people that don't have any significant visible narrowing, but have symptoms due to the small vessel disease, so I think the key is that it's your lifestyle.
So she's
Uh,
not, she's not a time bomb, she's taking care of herself with her diet and
Yeah, and exercising, and those are the key factors. It's not, I don't like to say, "Oh, you're a time bomb," unless I know more information. But that 50% narrowing by itself doesn't make you a time bomb. But there are other things. So if you're having a healthy lifestyle, you're exercising, in my opinion, a healthy plant-based diet, and you're looking at other biomarkers and things like that. Those are all important.